Hello, everyone, and welcome to Navigating Your Health Insurance, Answering Frequently Asked Questions. We're glad you could join us. My name is Aileen Gonzalez. I'm the Community Educator at the Breast Cancer Resource Center, or BCRC. I'm pleased to serve as your moderator today. The Breast Cancer Resource Center, BCRC, is a community-based nonprofit serving Central Texans impacted by breast cancer since 1995, strengthened by our mission to empower those affected by breast cancer with personalized support and compassion. And in collaboration with our community partners, BCRC envisions a future where no one faces breast cancer alone. BCRC offers individualized patient-centered care for diagnosis through treatment and into survivorship. Through its two pillars of support, guidance and education, BCRC certified patient navigators, whom all are breast cancer survivors themselves, empower those touched by breast cancer to become active and knowledgeable participants in their healthcare journey. This program is provided as part of a cooperative agreement awarded by the Centers for Disease Control and Prevention to expand our programs for young women. The purpose is to increase the availability of supportive services for young breast cancer survivors, young women with metastatic breast cancer, and their caregivers and families. The CDC funding continues today. We are so honored to have with us today Dr. Lynn Cowles and Aileen Lopez from Foundation Community's Prosper Health Coverage Program. Thank you, Dr. Cowles, for joining us today. Please join us on screen. And I will turn things over to you.
Thank you so much, Elaine, and just everybody at the Breast Cancer Resource Center. This is such an amazing resource. We are so happy to be participating and just sharing information with webinar participants here, and then also with the general public as this information goes out, connected to the basics of using health insurance. We did already create one video that is in the Breast Cancer Resource Center's video library resource bank. So we won't cover the basics that we covered in that video, but some of the other kind of more contextual information about health insurance. So we'll get right to it. I'll share some slides here. These slides will go out to participants after this webinar. Aileen is here reviewing the chat, and Elaine is collecting questions as well. So y'all feel free to ask away in those spaces, and there will be time at the end of this presentation for Q&A. So health insurance is oftentimes very, very particularly connected to people's individual household circumstances. So like how many people are in their tax household, what their incomes are, what their employment status is, what their immigration status is, all those very unique factors that come together to make a whole person influence to a great deal the kind of access that folks have to different kinds of healthcare programs. So oftentimes the answer to a question, you know, here's my circumstances, what do I do? The answer to the question is talk to an expert, which is what you're doing here today, getting a very kind of broad overview. And we'll share some information also about getting in touch with our program or other programs like ours across the state of Texas and around the United States, so that folks can reach out to local experts and get the information that they need to get the care they need, the supports from their communities and from their families, and for their families and communities as well. So without further ado, I will go ahead and start this slideshow, and we will get going here. Okay, so let's see, again, just another big shout out to the Breast Cancer Resource Center. Amazing material, peer support, practical supports for folks who are in their diagnostic or diagnosis journeys connected to cancer. And we're just so happy to be participating here today. And we're going to cover a lot of terms here. Like the ones that are listed on the screen here, I'm not going to read them all off. Some of this stuff, it's acronym city. Sometimes I will go ahead and make sure that we spell all of those things out. But this slide here is just a kind of like introduction to some of the topics that we'll be reviewing here today. And like I said, feel free to put other topics in the chat, specific questions connected to, I don't know, medication tiers or any specialist doctors, whatever kinds of things that y'all specifically want information about, because we're happy to share those details as well. Prosper Health Coverage is a program of Foundation Communities. This information is very specific to our organization, and there's some information here about the Prosper Health Coverage program. But the most important thing is that we here at Foundation Communities, through the Prosper Health Coverage program, are a health navigator organization. There are health navigators all over the United States. We are not the only one in Texas. And it's really helpful, like I mentioned, to get connected with your local health navigators so that if you have general questions connected to some of the material that I'm going to cover here today or other ones, you can get one-on-one advice from somebody who is unbiased. They're going to give you broad information about all of the health programs that are available to you in your area. And that is also very, very specific to your family and to your needs. So talk to the local experts. You know, there's not only like federal government-based programs, state-based programs. There's also local coalitions oftentimes in many, many places, like the Breast Cancer Resource Center, that are here to be supportive of community members as they, you know, navigate various health diagnoses or just looking forward to preventive care, right? So if someone is feeling great, but they're like, you know, I just want to make sure that I have a health plan in place, navigators can help you do that too. So we will get started here with some of the generals. So I'm not going to go too much into these public programs, but it's just a really helpful and necessary context as we get into some of the other types of terminologies and vocabularies that we'll discuss moving forward. So I'm just going to do this public program review very briefly. And Elaine and I did talk about doing another video connected to public programs that people have access to for affordable healthcare. So we'll dive more into this later in another video. But for now, just a review, Medicare is generally a public program funded by the federal government and by state governments as well to help people who are retired or people who have disabilities have affordable healthcare. On the other side of the screen is Medicaid, mostly for people, again, who have different kinds of disabilities than those who qualify for Medicare, for people who are pregnant or for people who are new parents or for children who are under the age of 19 years old. So these are both laws. So Medicare and Medicaid laws organized for US taxpayers to provide funding to people within certain age groups, disability categories, and age categories, or other condition groups like pregnancy to have access to affordable health care. So these laws passed in the 1960s and provided public funding for that kind of coverage, for health coverage. And the way that I remember Medicare versus Medicaid is with the end of the word Medicare. So generally, Medicare is for people who are older. People who are older tend to be retired if they are able to retire. Retirement starts with an R, and Medicare has an R in it. So Medicare, more for retired people, Medicaid, more for young people and people who are pregnant. So if that memory device is helpful for anyone, that's how I kind of keep my stuff together, because there are so many terms and programs connected to healthcare. It's really helpful to just kind of like, you know, have those little devices in place to remember which one is which. So in terms of health programs for younger people, there is also the Children's Health Insurance Program. Now, I'm not going to go through, I'm not going to read through these slides, but in general, and these slides, like I said, will be available afterwards, so folks can dig into these details later. But the Children's Health Insurance Program, or CHIP, is another program for low-cost medical care for people who are under the age of 19. It just has a little bit higher of an income threshold than Medicaid does. So Medicaid premiums tend to be free, healthcare tends to be free. People who are on Medicaid don't oftentimes have to pay for much of their medical care. With the Children's Health Insurance Program, because income thresholds are a little bit higher, folks who qualify for CHIP do tend to pay a little bit of a monthly premium, a little bit for co-pays to see doctors, a little bit for medications if they need medications, but it's still very affordable. And the other group of people who qualify for CHIP, or the Children's Health Insurance Program, are people who are pregnant and maybe don't have current documentation status as far as immigration goes in the United States. So CHIP Perinatal is an amazing program for people without current immigration status in the United States who are pregnant. CHIP Perinatal covers pregnancy-related issues, but not general health care, though. So importantly, there are limitations to CHIP Perinatal that are not subject to people who qualify for CHIP, the Children's Health Insurance Program, and those folks tend to be under 19 years old. And then, of course, there's Medicaid for folks who are under 19 and have lower income. So This is an overview. I realize it's been kind of slapdash or very quick, but again, we'll do another presentation that dives a little bit more into these public programs, but helpful to have that context as we move forward. Let me go back one. There we go. Okay. So those two public programs, Medicare, Medicaid, and then also CHIP. So those three public programs are available to those very specific groups of people. Now, before 2013, if people didn't qualify for one of those programs, one of those government programs, or for employer health insurance, as you can see here on the left-hand side, there's health insurance as an employer benefit, then those folks didn't have access to health insurance. There really was no public program for people who were not young or old or disabled or who had employer health insurance. So there was this big group of people who were maybe unemployed, or they worked for small businesses, or they had a collection of part-time jobs, or maybe they were self-employed. Those people just didn't have access to health insurance before 2013. And the reason that they did after 2013 was because in 2010 of the passage of the Affordable Care Act, another law, right? So we're going to talk a lot about laws in this presentation because it's our public health laws that give us access to these different kinds of funding for different kinds of affordable health insurance or health coverage programs. So in 2010, the Affordable Care Act passes, and it gives folks who don't have access to health insurance from their employers or Medicare or Medicaid or CHIP access to what are called qualified health plans. And we'll talk about what makes a plan qualified here in a minute. But importantly, the Affordable Care Act not only set up health insurance plans for folks who didn't have the option before, but it also set up some very specific laws about what health insurance plans have to do. So we'll get a little bit more into those laws moving forward. But importantly, this is the main option now for folks who maybe don't have employer coverage. Now, a lot of folks who are going through cancer diagnoses and treatment will have employer coverage. So the information about the Affordable Care Act, though, is still relevant because most employer health plans still have to meet standards, or they have to meet all the guidelines that make health insurance plans good that the Affordable Care Act set up in 2010. So like I said, we'll review some of those in a minute. Before we leave this slide, though, I want to make sure that we cover COBRA. So COBRA is another law. It passed in 1985. It's the Consolidated Omnibus Reconciliation Act of 1985. I remember it by those first three initials here, COBRA, C-O-B. And I think of COBRA because the COBRA policy did a lot of things, but it set in standard a set of guidelines for health insurance plans where people could have a continuation of benefits, right? Or COB, a continuation of benefits if they were moving from an employer plan away from that employer, right? So if somebody's moving away from their current employer, then that employer no longer has to pay for their health insurance for them if they did beforehand. But COBRA allows people to stay on those health insurance plans from employers up to 18 months and sometimes 36 months, but usually up to 18 months after people are no longer employed by that employer. The coverage has to be identical, which is a really important part of COBRA, because if people are switching away from an employer plan, maybe because they had a medical diagnosis, or maybe a family member had a medical diagnosis that kept them from working, maybe they went through their FMLA period, and or the law that requires people to be able to keep their jobs even if they have a medical or other family emergency. If people go through that period and it's expired and they end up losing their jobs, or maybe they just quit, maybe they just move on from those jobs. COBRA is the policy that requires those employers to allow people to keep their health insurance plan for at least another 18 months. Now with COBRA, though, just because an employer has to allow somebody to keep their coverage, the employer is no longer required to help people pay for it. So oftentimes employer coverage, the price increases a lot because there's no longer the employer there helping somebody pay for their monthly premium. And so COBRA plans can be super expensive because if a plan costs $600 or $700 per month, an employer is no longer contributing, $500 or $600 to it. That's the cost of insurance goes from $100 per month or $50, or maybe even sometimes it's free, up to the full cost of that plan. So there are opportunities for folks to move from employer coverage over to the health insurance marketplace through the Affordable Care Act. That's the plans that were set up by the Affordable Care Act when it passed in 2010. So that people can get onto a different type of health plan. Now, sometimes though, it's necessary for people to stay on their employer plan. And if that's the case, and if people have, money in savings, or maybe their spouse has, some income still coming in that would allow them to stay on their initial employer plan. If it's necessary to have that continuation of coverage from the employer plan for another 18 months, then COBRA, even if it's expensive, might be the best option. But again, these are questions that are very specific to people's individual households, their individual cases, and helpful to talk to a health navigator if you have one in your area, or even to just call one up if they're not necessarily local to you. Okay, so the Affordable Care Act, like I mentioned, that passed in 2010, it set up the following standards for all health plans. Now, back in 2010, there were some health plans, like from employers, that got what was called grandfathered in to the U.S. health system, which means maybe they didn't cover these things that are listed on the left-hand side of the page here, or on the right-hand side of the page, but they were allowed to maintain their status as health plans anyways. Now, most of those have kind of phased out since then. Employers have been really respectful of the fact that employees now want their health plans to cover the 10 essential health benefits. They want their employer plans to practice guaranteed issue. And that one's listed here. Guaranteed issue is the standard where health insurance plans cannot charge people more or deny people coverage if they have pre-existing conditions. So like I mentioned, most employer plans now follow these standards because they are now publicly recognized as necessary components of a good health plan. So all health plans, for the most part, meet the 10 essential health benefits, which are all listed here on the right-hand side. That means that all health plans have to offer ambulatory services. They have to give people access to emergency rooms. They have to cover maternity care, and so on down the list. Guaranteed issue, we already talked about a little bit. Minimum essential coverage is the standard where health plans must pay up to 60% of the cost of somebody's healthcare. So they have to have at least a 60-40 split between the insured person and the insurance company. And the 40% cost to the individual they have to max out at an out-of-pocket maximum that is standardized in whatever contract the covered person signs with the insurance company. So the health insurance plan has to cover at least 60% of the cost of somebody's healthcare. And if somebody's 40% contributions through maybe 40% of a surgery, 40% of a medication, 40% of doctor's visits, whatever those costs are, they have to max out at an out-of-pocket maximum. And that number is listed here. An out-of-pocket maximum is, this is one of the most important parts of any health insurance plan. So if somebody has, maybe they opted for the least expensive health plan to them, and their out-of-pocket maximum is $8,000 annually. Even if that person needs a $400,000 open heart surgery, the maximum medical debt that they'll go into, as long as they get that surgery at an in-network hospital, and as long as they keep paying their monthly premium for their health insurance plan, then they will never go into more medical debt than $8,000 for that year. So this is the real benefit of health insurance, because, I mean, if y'all have ever looked at any of the costs of healthcare, there's a lower intestinal surgery that costs over $1 million. And so if somebody has to have that surgery, an out-of-pocket maximum, again, will cap them out at whatever that out-of-pocket max is, no matter what health plan they get into. And the amount does shift. So if people have lower monthly premiums, they tend to have higher out-of-pocket maximums, but there's still that method or that strategy for risk prevention so that people have that out-of-pocket maximum in place if they get into a qualified health plan. And now we will move on to a little bit of information about non-qualified health plans. So non-qualified health plans are all over the place. There are many different kinds of them. Some of the different types of non-qualified health plans are listed here in these bullet points. They are offered by healthcare sharing organizations, primary care subscriptions. Sometimes they're called short-term or limited benefits plans. A student health plan is a non-qualified plan. And what that means, what non-qualified means, is that these plans do not meet the minimum essential coverage and the essential health benefits of the plans that of the health insurance plans that we looked at on this previous slide. So non-qualified plans do not meet those essential health benefits. And so they don't give people protections against medical debt, against the major medical debt that people can get into if they, if they need that $1 million surgery, if they need that open heart surgery, or if they get an expensive diagnosis that requires them to pay for medications that can sometimes cost $3,000 or $4,000 or more than that per month, right? Oftentimes, if people get on the internet and they search like find affordable health insurance, they'll get to one of these sites or one of any number of other websites out there that will collect sometimes qualified health plans with other non-qualified health plans, or will just list out non-qualified health plans in general. So these are the websites oftentimes where people will go like, okay, I have to put in my name, I have to put in my phone number, I have to put in like an income estimate or an email address. And then they press send. And then sometimes they'll get a notification back that says, okay, an agent or a broker will be reaching out to you to tell you some information about the plans that are available. And then people get 60 or 70 calls, right, over the course of the next maybe 1 or 2 weeks. So the agents and brokers that work for those websites or for non-qualified health plans oftentimes do have good intentions. They want people to be covered under health plans that are good, that are qualified, that are affordable. But oftentimes the training that goes into the agent and broker relationships, or the agent and broker employees that work for these types of companies, they just don't have a full picture. They haven't been through a presentation like this that tells them exactly what kinds of coverage their plans offer. So they'll tell people over the phone, yeah, sure, you have access to medication coverage. Sure, you have access to specialists. And then when somebody gets into one of these limited benefits plans, they go to the doctor and the doctor says, oh, you can't see an oncologist on this plan. That's not possible. Your plan doesn't cover oncologists. So it's really important for folks to know that these non-qualified health plans are out there, and that it's really, really important for folks to know what they're getting into so they don't get surprised when they go to the doctor. We do not recommend that people get into non-qualified health plans, but sometimes if it's affordable and if it meets the mark, for people while they're maybe in between jobs and they feel comfortable taking on the risk of maybe not having access to emergency care or not having access to specialists, then that's totally their call. But we don't recommend it. And we recommend that people do reach out instead of to agents or brokers or to any of these non-qualified health plan sources, that they reach out to health program navigators in their area, like ours at Prospera Health Coverage or Foundation Communities, or whoever the local one is, wherever you are. And there's just another reminder that those non-qualified health plans do not meet those essential health benefits or minimum essential coverage standards. This information on this slide, we already shared in the other video. It's just here as a quick reminder for folks that the way that health insurance makes healthcare affordable is by sharing costs with insured people. So when people get into a health insurance plan, they pay a monthly premium, and then based on their monthly premium, the contract with the health insurance company sets up maybe a deductible, maybe some co-pays. It sets up that out-of-pocket maximum that we talked about earlier, and co-insurance for insured people. And co-insurance is like a percentage split. Like if somebody needed a $10,000 surgery and their co-insurance was 20%, then $2,000 would be their co-insurance and $8,000 would be the health insurance company's co-insurance. But again, examples aside, there is another video in the Breast Cancer Resource Center's video resource library that explains these cost sharing terms. And if anyone wants a refresher on that, please feel free to go look at that video, and we'll move forward for here just so that we can get through all of this information as well. So the first thing that we'll talk about is provider networks. I mentioned earlier that the out-of-pocket maximum applies to folks if they are seeing doctors in their network and paying their monthly premiums on time. And so it's really important for folks to know what their provider network is. So very generally, a provider is a person who provides a medical service, whether it's medication like a pharmacist, whether it's a specialist like an oncologist. anybody who has any kind of like background or certification in providing a certain kind of healthcare service. That's a provider. And then a network on the other side is a list of those providers, whether it's a laboratory, whether it's again, like a pharmacy or a hospital, an ambulance company, anyone who is contracted by a health insurance company to help people who have that health insurance get access to care. So there's different, we'll go into the different types of networks a little bit further along, but for now, importantly, for most health insurance plans, people do have to pick a health insurance provider, a health provider through their health insurance company's network in order for the health insurance company to help them pay for it. So you can see these graphics here are really, really helpful. If you're picking somebody who is in network with your health insurance company's provider directory, which again is just that list of doctors or healthcare providers, then it's oftentimes more affordable than if somebody goes out of network. If somebody goes out of network, on most plans, the health insurance company will not help them pay for those costs at all. So they would be looking at paying 100% of the cost of whatever treatment or whatever service they got. But if somebody goes in network, then remember the previous slide, the health insurance company will honor their cost sharing agreements with that person. So they will share the costs of that doctor's visit with the insured person. And then, right, there are circumstances though, when people can go out of network and get in-network costs. And those are, in general, in life-threatening or limb-threatening emergency situations. So if somebody develops a diagnosis or develops a condition that requires long-term medical care, that is a very important medical circumstance, but it is not an emergency, right? It's not a life-threatening or limb-threatening urgent situation where somebody will, perhaps suffer life or limb-threatening conditions if they don't go to a hospital emergency. So if somebody's provider network is within a certain region, say it's within the Central Texas region, or even within a state or a set of states. So like, say I'm in a health insurance plan that covers like Louisiana, Texas, and Oklahoma. And some of those exist out there for employers. If I'm in Florida visiting my brother and I'm in a car accident and I'm knocked unconscious, then I can go, an ambulance can take me to a nearby hospital because, that could be a life-threatening situation. However, if I am in Florida and I sprain my ankle while I'm playing with my niece or my nephew, then that's not a life-threatening condition. So a good thing for people to do before they leave their provider networks is to look up clinics or low-cost medical providers in the area where they're going. Oftentimes, those are called federally qualified health centers. And federally qualified health centers, or FQHCs, will offer sliding scales for people to get medical care, sliding cost scales based on their incomes. So before you go somewhere, before you're leaving your network, look up the FQHCs and just say, like, if I sprain my ankle, where should I go to get low-cost medical care instead of the hospital? Because the hospital is always going to cost more. And listed here are two different types of care, right? We just talked a little bit about emergency care, avoiding that whenever possible, of course, maybe by seeking out federally qualified health centers if you're not within your provider directory or your provider network. But if you are within your network, or maybe you're in one of those types of health plans that allows you to go out of network, then oftentimes you'll be looking at a primary care doctor or a specialist care doctor. Specialist care doctors include surgeons. They include anesthesiologists, orthopedic surgeons, physical therapists, right? Those are all different types of specialized care. Those doctors and those treatment providers have gone to school and have gotten, have oftentimes just paid much more into their educations to provide that type of specialist care. Versus primary care doctors who are, obviously like also very well educated, very well certified. But primary care doctors are your kind of your general doctor, the one who you go to before you can see a specialist, or before you know what kind of specialist you need to see. So I really like this this diagram here, because sometimes we'll go to a primary care doctor, you call up your general practitioner and just say, like, hey, Dr. Flores, I have this ear thing, like, I'm not sure what's going on. It's been going on for a couple of months. I don't really know like why it's not going away. I'd like to make an appointment. So you make an appointment with your primary care provider, who is not specialized necessarily in ear, nose, or throat care, but you need to see them so you can get kind of a baseline understanding of what's going on. And then your primary care doctor goes, oh my gosh, like this condition that you have, I'm looking in your ear, it actually makes me think that you need to see a cardiologist because your ears and your heart are connected in ways that are amazing and hard to explain right now, but your ear condition could be a heart condition. Let's get you to go see a cardiologist, right? And now this is just kind of an example, but it's amazing how sometimes you go see a primary care doctor and maybe they take a blood test and look at your kidney levels and they say, oh my gosh, you need to go see a kidney specialist, or there's a specialist who you need to see based on our initial assessment of your condition. So primary care doctors oftentimes are the ones that people will see first before they go see specialists. And whether or not people can even see a specialist without seeing a primary care doctor first depends very much on the type of health plan that they're in. So we'll look at some of those different types of health plans now. So what you have here listed are health maintenance organizations on the left, exclusive provider organizations in the middle, and preferred provider organizations on the right-hand side. So all of those acronyms there are probably, at least the ones on the left and right, HMO and PPO, are probably at least recognizable to folks. So I'll just do a quick review of those two, and then a little bit more in depth on the exclusive provider organization, or EPO, in the middle. So the HMO plan is a health maintenance organization, and it requires people, and you can see it in the list here, to see doctors who are in their network, right? Who are in that list of providers or treatment professionals who are in that list of covered doctors for that plan. So there's no way to see anybody who's out of network unless there's an emergency. They do have to see their primary care physician before they can get a referral to see a specialist. So a referral is the process of basically getting assessed by a primary care doctor, and that primary care doctor says, okay, you need to go see somebody else, right? I have all kinds of expertise, but I don't think I have the expertise that this specialist has, and so I'm going to refer you to a specialist. And so the HMO plan goes very specifically in this order. You got to see the primary care physician. The primary care physician has to be in the network of the plan. And if you need to see a specialist beyond that primary care doctor, you must get a referral or a note that says, hey, I checked this person out. I think they need to see you, cardiologist, or you, dermatologist, or what have you. On the other side is the preferred provider organization. This is a plan where people can go in network or out of network for their health treatment needs or medication needs. Oftentimes with PPOs, if insured people do go out of network to see a particular doctor, maybe they have a gynecologist who they've been looking at for a long time, or who they've been seeing for a long time, and they don't really want to switch over. If people do go outside of their health insurance company's network, they will oftentimes have to pay more. On the PPO, though, the health insurance company will still help them pay for the cost of seeing that out-of-network doctor. On the HMO, if somebody goes out of network, the health insurance company is not going to pay for it, even if it's a service that would normally be covered under that health plan, right? It's because you didn't see a doctor in that network, the health insurance company won't cover it. But the idea of the preferred provider organization is that insured people can see the providers who they prefer. Maybe they know somebody who's not in that company's provider directory. But so oftentimes with the PPO also, people do not need to make a referral, or do not need to get a referral to see a specialist. So if you're on a PPO, you might have to pay a little bit more from out-of-network doctor, or you can still choose an in-network doctor for care, but you just don't necessarily have to see the primary care physician before you can see the specialist. So if you feel like you have a heart condition, you can pick a cardiologist out of that provider directory, or a cardiologist who's maybe not in that provider directory, and go see that person, and the health insurance company will help you pay for it. And then in the middle here, we have the exclusive provider organization. And the exclusive provider organization is sort of like a halfway point between these two different types of plans. So like the HMO, it also has a list of doctors that insured people can see in order for the health insurance company to share costs with them. But unlike the HMO, people do not need to see a primary care physician to get a referral to see a specialist. So as long as you're looking through a list of doctors that are covered by that plan, people can skip over the primary care doctor if they want to, and make an appointment to see the specialist as their first appointment, sort of. So there's no like one plan, one of these types of plans is better than the other. Some people actually prefer the HMO because they don't want to go through the process of looking through their provider directory and finding a specialist who they think would be good, and maybe getting online and doing the research and looking at the provider ratings, right? Some people very much want to see an individual person, a primary care doctor who knows their health history, who they feel comfortable talking with, and just letting that primary care physician make them a referral to see the specialist. Other people might prefer the EPO because they feel comfortable navigating provider directories and they don't want to pay the full cost of the PPO. So they're like, okay, I'll choose a plan that has a network, but I'll just be able to make my own specialist appointments if I want to. So it really just depends on what kind of health insurance user a person is that will determine which type of plan is best for them. Also, though, like if somebody is on the health insurance marketplace that I mentioned earlier, the federal option for people who don't have employer coverage, we in Texas do not have a preferred provider organization available to people who are on the health insurance marketplace plan. So for people who are on those plans, they have to choose between an EPO and an HMO. And this is just helpful information for helping folks kind of like figure out which one of those plans might be best for them. Employer plans sometimes do have a PPO option, but not all the time. Okay. Now we're going to go through metal levels here. The metal level kind of descriptor for health insurance plans is a helpful comparison tool, but like with the types of different health plans, like with HMO, EPO, or PPO, gold is not always the best. PPO gold might not be the best plan for somebody versus like an HMO bronze plan, right? So don't let the metal levels make you think that, oh, the gold plan is the best or the silver plan is the middle ground, because in reality, like metal levels are not always super helpful because value is different for every person. Like I mentioned at the beginning, everybody lives in different household circumstances. I've literally touched like I've helped people with thousands of health insurance applications over the last decade or so. There is no way that one household's one household circumstance is exactly the same as somebody else's. So because value is different to every family or every person, the bronze plan might be better than a silver plan for some people. So in general, though, gold plans, we mentioned earlier that if somebody pays a higher monthly premium, then they'll oftentimes have lower deductibles, lower costs that they share with their health insurance company. So the exchange then is for the higher monthly premium, then the cost of seeing doctors and getting medications goes down. So this is a good plan for somebody who maybe knows that they need an expensive surgery coming up. So if somebody is willing to pay $200 per month for their plan instead of $20 per month, if they pick the gold plan, then their out-of-pocket maximum might be $1,000 instead of $8,000. And the calculation there is that $200 per month, the higher monthly premium times 12 months, as long as you have that lower out-of-pocket maximum, is actually better for somebody who knows they need a lot of medical care. On the other end are bronze plans. Bronze plans have the lowest monthly premium and they have the highest costs for medical care. And this is a plan oftentimes for people who don't think that they're probably going to see a doctor a lot in the year. They mostly just use their health insurance plans for preventive care. Maybe they go get an annual physical. If this is a person who qualifies for a well woman visit, maybe they go get their annual well woman visit. And then other than that, they're probably not going to see the doctor very much. And so they might get into a bronze plan that has the lowest monthly cost and the highest cost to see doctors and get medications because they don't anticipate seeing doctors or getting medications throughout the year. Now, that said, there is risk involved with the bronze plan, right? So some people might say, okay, I don't see the doctor that much, but I'd still like to maybe pay a little bit more to drop the costs of seeing doctors and getting medications. So in that case, the silver plan might be best for somebody because they don't anticipate needing a lot of health insurance or needing a lot of health care, but the health insurance risk protection is what they're really in it for. So in that case, somebody might not want to pay the biggest monthly premium for a gold plan, but they might want to pay a monthly premium that's kind of like in between bronze and gold to drop their co-pays for medications or doctor's visits a little bit. in case they do need to see the doctor throughout the course of the year. So most health insurance plans offered by either employers or on the federal health insurance marketplace will have some collection of like tiers of plans, whether it's the premium or the base plan, or on the federal health insurance marketplace, all companies that offer health plans are required to offer bronze, silver, and gold options for people who have these different needs connected to medical care, monthly payments, and then also their own assessment of risk as they think about what they might need to do throughout the course of the year. All right, and we'll keep going here. And we're on to medication management. So medication management is, of course, really important for people who have long-term diagnoses or even short-term diagnoses, like diabetes, like asthma, like cancer. And so knowing what medication tiers are connected to their health plans is a really important part of that knowledge and usage of health insurance plans. So all health insurance plans, no matter what the source is, will have a formulary attached to it. A formulary is kind of like a provider directory, but it's for medications instead. So a formulary will have a list of medications for which a health insurance company will help people pay the cost of the medications on that plan. So if somebody needs a medication that is expensive to produce, or maybe it's a newer medication, but it works really well for them, and maybe it's not a generic medication. If it's a new or expensive medication, oftentimes health insurance companies will cover that drug or another similar one. So for people who do have current medication needs, it's really, really important to take a look at formularies before you choose a plan. Because one plan might cover a certain type of medication that another plan or that another company will not cover. And so you want to pick the plan then that has the medication that you take in that formulary. Because if you pick the other one, if the medication is not in that list of covered drugs, then even if you have, say you have a $1,000 out-of-pocket maximum and you're looking at a $3,000 medication, if you picked a plan where that medication was in the list of covered medications, once you had to pay for that medication once, the insurance company would have to pay for it for the rest of the year because you would have reached that out-of-pocket maximum. But if you're on a plan that doesn't cover that medication, then there's no guarantee that that plan will help you cover the cost of that medication because it's not in the list of covered drugs or the formulary. So doing that formulary research before people pick health plans is really, really important. And then medication tiers here listed below. These are the different costs that people will pay for different types of medication. So the cost tends to go up as people go up medication tiers. I've never seen a plan that didn't have higher costs for higher medication tiers. So tier 1 is our generic medications. These are medications that have been produced for so long that their patents have generally expired, and medication producers all over the world are able to produce that medication. And because there are multiple pharmaceutical companies producing that medication, more people can make it, and so the cost of it drops. And then in tier 2, you have generic medications, which are the same as preferred generic ones, right? But the health insurance company might just recognize that these medications are maybe a little bit more expensive to produce, but they're still relatively common. So they'll charge a higher cost for that medication, even though it's still generic, because it's not considered preferred by that health plan. And there's no, just to be totally clear, there's no standards for what medications are considered preferred generic, preferred brand, non-preferred brand. Every health insurance company has an executive team that will look at medication costs and determine at what tier each medication will be in for that next year. It's fully at the discretion of health insurance companies, but there are common things like blood pressure medications, SSRIs for people who maybe have a mild anxiety condition. Those tend to be preferred generic medications. And so there are some like statins, for any kind of cardiology condition that will be preferred generic. But then as you go up the list, the rarer and more expensive it gets for medications to be produced and for them to be widely available, that's where you get when drugs tend to be more expensive. So brand drugs are ones that are still under patent that only certain companies can make. Non-preferred brand drugs are in that same category, but the health insurance company has determined that they are either not common enough or not inexpensive enough for them to purchase, for them to qualify them as tier 3 brand medications. So they call them non-preferred brand medications because the insurance company does not prefer them, right? So it costs a little bit more. And then in tier 5, you have specialty drugs. And a lot of our oncology medications come here. A lot of injectable medications are tier 5. So the style of medication administration, like whether it's injectable or under the tongue or chewable or whatever, there's no real like clear sense of that. The medication type doesn't determine tier. It's just like the expense of producing it and the availability usually. All right, and let's see here. Right, the note that I already made for people who do need specific medications. And oftentimes there are people who just, respond better to a certain brand medication over a generic version of that same medication. For those folks, if you need the brand, consult the formulary or the list of covered medications before you choose a health insurance plan. All right, the summary of benefits and coverage. This is a standardized document, although they don't have standardized terms in them necessarily, that every health insurance company must give you when you sign into a plan. They can send it to you electronically. Most companies will send it by the mail as well, but this is where you get the really specific, I call it the nitty-gritty information about your health plan. And so you can see here, this is the front page of a summary of benefits. We're not going to go through an entire one today. There's just too much information packed into these. If you do get a summary of benefits that you want to look at with a health navigator, again, like find your local experts. We recommend navigators over agents and brokers just because navigators will give you the full picture of all the options available in your area. And they can also help you translate or interpret or really get a good understanding of what these summaries of benefits cover. So you can see here that a summary of benefits will cover, it'll show you your deductible. It'll show you your out-of-pocket maximum. It'll give you, let me move on to the next pictures here. It'll give you a sense of how much your costs for doctor's visits are, right? Primary care doctors, maybe for preventive care here. If you need a blood test, like a diagnostic test, on this plan, you can see that somebody has to meet their deductible before the health insurance company will help them start paying for the cost of that blood test. Versus here, you can see that the blood test has a flat fee of $200 per service. And you can see that here because this summary of benefits says after deductible, and this summary of benefits just says $200 copay per service. And just in case, if anybody's listening and not watching, we're looking at the summary benefits on the right-hand side versus the one on the left-hand side here. So again, these documents are so specific to each plan that it's not really helpful to go through summaries of benefits in a presentation setting like this, but it is super, super helpful to talk to your local health insurance navigator and make sure that you know what your summary of benefits covers and how much it might cost for something like physical therapy, how much it might cost for a surgery. Make sure that those preventive screenings are covered at no cost to yourself also. And that's a standard that covers, that goes across all plans. Preventive care is free. So if there is a preventive care service that somebody is considering getting, the health insurance company will pay for 100% of it. A well woman visit, a lung cancer screening, a breast cancer screening for people who are over 45 years old and so forth. All right, let's move on here. Now we'll talk about claims. This is one of the more anxiety producing, I mean, many things about health insurance are anxiety producing, but claims can be, claims and appeals can be a couple of the most. So what we're going to do here is just talk a little bit about how the claims and appeals process works. Again, it's so specific to each health insurance company that there's no way to really like give somebody a boilerplate template that says, if you need to appeal a health insurance claim or a claim that you made to a health insurance company or that your provider made to a health insurance company that got denied, there's no like template language to use. But again, health navigators are here to help people make sure they can talk to their health insurance companies, talk to their providers, and get the services covered that should be covered. So a claim is basically just like it's a request for payment. So the doctor sends a list of whatever you got done in their office over to your health insurance company. That's why the doctor's office asks you what your health insurance plan is before you get there. You oftentimes have to give them like your member ID number and whatnot, so they can bill the health insurance company directly. If a health insurance company denies that claim, then the insured person can file an appeal. An appeal is an argument. It's oftentimes written. I've never heard a health insurance company that only did like verbal arguments, but it's a written argument that explains to a health insurance company why they should cover that service. And there's lots of different components to a claim and appeals process. And again, this is a quick overview here. But if anybody would like more details about this, we can do another video. We can talk one-on-one and so forth. So this is where it all starts. Starts with a person who needs healthcare, right? Person needs healthcare, go to the doctor's office. Maybe they're on a PPO, maybe it's out of network. Any of those things we talked about earlier. The doctor's office uses the insured person's information, or for uninsured people, that arrow might just reverse back this way, right? And they might just send that bill right back to the person if they don't have an insurer. But generally, since most people can't afford healthcare without having an insurance plan, the doctor's office will then send that bill or that claim over to the insurer. The insurer will send it through a claims review process. It'll get accepted as is. So the person who paid their copay, maybe they still owe some co-insurance. Maybe the health insurance company rejects that claim fully. Whatever happens, the health insurance company will then print up an explanation of benefits, and they will send it back to the person who got the medical care. And then this person, if they read through the explanation of benefits, and maybe that claim has been fully denied, or maybe they're getting a co-insurance amount that is different than what they see on their summary of benefits, then oftentimes what they'll do is they will go back to the doctor's office and they will do some research. So the research that we help people do with doctor's offices is like seeing what codes those doctor's offices sent over to the insurer for what treatment or what services the individual got done there. So every single doctor's office service, whether it's a stethoscope in the heart, whether it is a breast massage for an exam, whatever that service is, it's got a code attached to it. And the doctor's office sends those codes over to the insurer, and the insurer says, okay, we cover that code or we don't cover that code. And then that's what happens in the claims review process. So the doctor's office, though, it's not always a fail-safe process. So if the doctor's office maybe miscodes something or adds a code into the visit that didn't actually happen, they'll send the wrong information to the insurer. And it's not malicious, it's just data. It just happens sometimes. So it's really important for individuals to know what services they're getting, to inspect their bills, and especially to inspect their explanations of benefits to make sure that their insurers and their doctor's offices are all on the right page as far as the care that they're getting. And then after that person does that research, they'll write the argument, say there's a code that got inaccurately added to the list, or the insurer is denying a cost-sharing amount that they should be covering. The individual, oftentimes with the help of a navigator or a patient advocate, will write an appeal to the insurer that says, this is why you should cover that. And then the insurer will get back to that person and say, oh, okay, you're right. We should have done that. Or you need to, this is what it is, in which case the person could either send another appeal or reach out to the Texas Department of Insurance for regulatory oversight. It is really helpful, and you can see that I popped it into the slide here, to work with a navigator or a patient advocate to go back to the insurer. And a patient advocate is like a navigator. Patient advocacy is it's a concept more than it is like a certificate or a title. But the point of a navigator is to be an advocate for patients to make sure that they're not getting overcharged for their medical needs. And then also, I just wanted to make sure that we make this really clear also. Before somebody even goes to get treatment, they can call their navigator or their patient advocate, whatever kinds of relationship people have with their local organizations before they even go get the treatment, right? So if you have a doctor's office coming, or if you have a doctor's appointment coming up with a specialist, then we can work with people to say like, okay, here's what your copay should be. Here's the kind of services that they'll likely provide there. Here's what your bill should be from your health insurance company when you eventually get it. And then that just gives people a little bit of peace of mind, knowing in advance what kinds of things they can expect at the doctor's office and what they should be able to expect in the explanation of benefits afterwards. So definitely, again, use the local resources that you have to make sure that you can get a full picture of what the healthcare should look like before you get there. And then that just empowers people. It empowers people to know more about the treatment that they're getting before they even get into the office. And it just reduces some of the confusion a little bit. I'm not going to read through this slide. These are just some helpful tips for people before they go through an appeals process, right? Keep copies of everything. Make sure that you're trying to get that appeal in as soon as possible, because oftentimes there is a 180-day or a 6-month limit after that explanation of benefits goes out that people can actually appeal. So this is some information that's helpful about the appeals process. And here on this last slide is just some, let me see what time it is here. Oh my gosh, it's almost 1. So I'm actually just going to skip this slide. And we'll go straight to questions, because we will do another video about the Affordable Care Act connected to those public health programs, like I mentioned. And let's open it up for Q&A, and I will stop sharing. And let's see, Aileen here, I think, or no, Elaine, you had, we're collecting questions from the chat.
Yes. Thank you, Dr. Cowles, for that very informative presentation. And so thank you, Aileen, for joining us. She is also here with Foundation Communities. And we are, we'll go over some questions. We may run over on a little bit of time. And so please remember that the full video will be available in our video resource library if you miss any part of this. I do have some questions I would like to ask here, just a couple of questions, not too many. I think some of the ones that are most asked when talking about treatment. And so the first one is, so you talked about medications, and one of the questions is, so what if the insurance does not cover a medication? What should they do? You know, what other avenues do they have?
Yeah, that's a great question. And it definitely happens sometimes. Like I mentioned in that medication management slide, that the best thing to do is to make sure that your insurance company covers the medication, right? If you know that you need a certain kind of tier 5, tier 4 specialist med, anything that is on the rarer side of being covered by health insurance companies, then preempt the situation where the health insurance company doesn't cover it by getting into a health plan that does, right? But that said, if people work for an employer and they only offer a couple of different health plans and the medication that an individual needs is not covered by it, then the Affordable Care Act also establishes what's called the condition of medical necessity. So medical necessity is the policy whereby health insurance plans actually have to cover any medication that a doctor says is medically necessary. So there's always a couple of months of appeals and back and forth with the health insurance company, but if individuals can get a doctor to agree to work with them to get their health insurance company to cover their medication, then the doctor's office can send letters of medical necessity to the health insurance company that says, this person needs this specific medication, it is medically necessary, and they have to use that specific language. And then the health insurance company, and sometimes we have to involve the Texas Department of Insurance in there, which is our regulatory body here in Texas, to say, okay, the health insurance company doesn't normally cover that medication, but here it has to. And that can take some time, you know, so it is important for folks to try to preempt that process as much as possible. But it is part of the law that health insurance companies cover those medically necessary medications. Aileen, did I miss anything there? No? Okay.
Okay, great. Thank you for that. Another question that comes up is, do some insurances pay for transportation or home health after surgery?
So usually those types of like supplementary programs will be part of like an employer assistance program. But some health insurance companies will. It's not required though. And so people will sometimes need to coordinate with maybe friends or family or community members to get rides home from hospitals and whatnot. If there are surgeries or any kind of like doctor's appointment that might prevent somebody from being able to drive. But there are also lots of local resources. So like here in Travis County, and this is why it's important for people to talk to their local navigator, because local navigators will know about programs like this. But in Travis County, for people who have medically necessary appointments, there are programs through Cap Metro, our local transportation company, to help people get to and from doctor's appointments. So we can help connect people with that resource. Oftentimes there are specific organizations or even offices that will have relationships with ride sharing companies like Uber or Lyft that can take people to and from doctor's appointments. So that's one of those really helpful kind of like supportive things that would be awesome for all health insurance companies to have, but not all of them do. And so oftentimes it could be through an employer assistance program, through a specific doctor's office, or through a public program where people can get that kind of help.
Do you recommend though that they check with their insurance company to see if there is that type of program?
Oh yeah, definitely, 100%. And those types of things, because they're not built into the law, would not necessarily show up on a summary of benefits. So that's the kind of thing that either if people felt comfortable calling on their own, or if they wanted to call with a patient advocate or a navigator, then it's helpful for just to, to get somebody who has the kind of vocabulary of health insurance on the phone with you to help you navigate those questions. But yes, 100%, always check in with your health insurance company to see what kinds of like, this sounds very like, it sounds kind of like crony-ish, but like figure out what the perks are, it's like, it's not a phone plan, right? It's a health insurance plan, but like oftentimes they do have certain perks that will compel people to pick one over the other.
Right. Okay. Okay. Another really common question is does insurance pay for integrative therapies, physical therapy, lymphedema therapy, pelvic floor therapy, mental health therapy, right? Those that are not, more common therapies. And with an integrative therapy, a lot of, want to see acupuncture, right?
Mm-hmm.
So are those type of therapies covered under insurance?
Gotcha. Well, Aileen, why don't you take mental health, just since we've heard my voice a lot, and I can speak to the other ones.
Hi, everyone. Yeah, so depending on the type of insurance that you have and your benefits that you have, your summary of benefits usually has everything that like is listed of the, what is covered, what is not covered. Everybody's plan is different. Everybody's coverage is different, especially from employer plans. So if you do have any questions, whether or not your, any mental health services like, therapy is covered, then definitely check out your summary of benefits. Also, if you don't know, if you have employer coverage, you can always reach out to your HR department to get more information about that. If you have marketplace coverage, then you can always speak to a navigator or even call the insurance company to go ahead and get more information about your benefits of your summary of benefits. But if you are enrolled in a plan who meets the 10 essential benefits, then mental health is covered. And it just depends on your, benefits, how much you would pay, co-pay, co-insurance, etc.
Thanks, Aileen. Yeah, that's exactly right. So if a plan meets those 10 essential health benefits, then it must cover mental health care. That's part of the Affordable Care Act, that to make mental health care available to folks more widely is health plans must cover mental health care services. As far as other integrative therapies, physical therapies, again, if a doctor says that it's medically necessary, then the health insurance plan has to cover any kind of treatment. It would be rare though to get a doctor, even a primary or a specialist care physician, to say that like this type of acupuncture is medically necessary. Acupuncture and chiropractic are not considered one of the 10 essential health benefits. So if somebody does want to incorporate one of those types of therapy into their medical treatment plan, it's unlikely that you'd be able to get a doctor to claim medical necessity for one of those treatments. However, physical therapy is. Physical therapy is a recognized and standardized part of all health plans, that they must cover physical therapy as long as, again, a doctor says that it's medically necessary. Some people do have limitations on the numbers of times they can go see a physical therapist. Again, if you reach 20 or 35 visits and you need more than that, like we would work with the doctor, or the individual can work with the doctor to get that health insurance company to extend past those visits as long as they're medically necessary. But for the question of acupuncture or chiropractic care, it's unlikely that there would be a doctor who would say that this is 100% medically necessary for this person. So best, again, to like learn what your local resources are, I've recommended South Austin acupuncture to people here in Austin before. So again, that's like one of the real benefits of working with your local navigator is that they know about some of those programs that might be supportive to your health plan if they're not part of your actual health insurance plan.
I do want to go back to the mental health real quick. And so more and more, I think professionals are not accepting insurance. I know that's been a real issue here for us in Central Texas. So what can is there a way to get part of it, partial payment for this therapy if their provider does not offer insurance or file insurance for them?
Yes. So I'm unfamiliar with health insurance plans, as long as they're qualified plans, that will not cover mental health care visits. Now there are different types of mental health care, of course. So there's like talk therapy, counseling with a social worker, a licensed mental health care provider. And then there's like psychiatry, you know, and cognitive behavioral therapy and all the rest of it. So there's many different types. So all plans that are standardized after 2010 post ACA do have to cover mental health care therapy. So if it's a question of like looking through the provider directory and making sure that we can identify which doctors provide that type of therapy, and then just making sure that folks can reach out to those doctors and make appointments with them, because, you know, even like availability can be an issue sometimes. So yeah, I think this might be a question of like making sure that that folks are utilizing their health insurance plans to their best benefit and are understanding the comprehensive benefits that are offered by their plans. So I'm unfamiliar with, again, a qualified health plan that would not cover mental health. And so my recommendation would be to like, let's dig into that summary of benefits a little bit. Let's dig into that provider directory and make sure that people are looking up the provider directory or looking up providers using the right terminologies. And one thing that I didn't get a chance to do in this presentation was to flip over to a couple of different examples of provider directories, just because we were running a little bit short on time. But provider directories, those lists of covered doctors, are not standardized either. They can be clunky online databases to use. Some of them are super friendly and streamlined, but in all cases, it's backwards, right? Because the user, the insured person, has to know what to search for in order to find the right doctor. But if you don't know if your therapist is called a behavioral therapist or a counselor or a mental health care professional, or like any of the number of terms that we use to describe what mental health care providers do, then you won't find that therapist if you're not looking up the right terms. So oftentimes it's a question of like terminologies and searching, rather than it is like a plan having a gap in mental health care coverage, unless it's one of those non-qualified plans that we talked about earlier, because those plans are not subject to the same standards that qualified health plans are.
Okay, great.
Yeah.
I think we have time just for one last question, and I still want to kind of stick to sort of the treatment questions. 3D nipple tattooing. So is there medical coding? Will insurance cover that? I think you know, someone's getting a little bit of pushback from their insurance and trying to get that covered.
Gotcha. This is part of our health laws that affects many people in many different ways. And it's whether or not the insurance company via the state of Texas, because the state of Texas does still govern our health insurance policies here in the state. Like, plans have to meet federal regulations, but then states will oftentimes impose their own regulations that kind of like further specify what plans can cover and not cover. And here in Texas, anything that the state determines is cosmetic does not have to be covered by a health insurance company. And I'm not saying that in a way that like that if the state says so, then it's somehow like right or accurate or connected to actual healthcare experiences or diagnoses. But so I would have to look into that specific issue. And I don't know off the top of my head, but just in the way that you're describing it right now, it makes me think it's probably something like bariatric surgery, sometimes like breast reduction, sometimes even a full breast removal, that the state might understand that that's cosmetic and not medically necessary. However, again, the language of medical necessity, the principle of medical necessity is the really important one here. So if a doctor says this person needs that type of tattooing, it's necessary for them medically, then the health insurance company will cover it. And again, like there could be back and forth between the insurance company, the provider, a patient advocate or a navigator, and the covered individual. But if a doctor is willing to go to bat for that person and say like, this is an object, or this is a medically necessary procedure, then the health insurance company will have to cover it, as long as people are willing to go through that process of making the health insurance company accountable to that person's health needs.
Okay.
Yeah.
Great. Well, that is all the time we have for questions today. Thank you, Dr. Cowles and Aileen, for sharing your expertise and valuable insights. This is incredible. Remember to visit the video resource library on our website for also additional informational videos. And thank you for joining us